Cheese, especially processed and aged varieties, may seem like a harmless indulgence or a convenient addition to meals, but for people with high blood pressure, it can be a surprisingly potent risk factor. While cheese does contain some beneficial nutrients like protein and calcium, these are often overshadowed by the high levels of sodium, saturated fat, and additives present in many commercial products. Sodium, in particular, is a major concern, and cheese is one of the most underestimated sources of salt in the modern diet. Many cheeses, such as processed American cheese, feta, halloumi, and even some cheddar or blue cheeses, are exceptionally high in sodium. A single slice or small serving can contain 200 to 400 milligrams of sodium, meaning that a modest portion can quickly contribute a substantial fraction of the recommended daily sodium limit for someone with hypertension. For people who enjoy cheese regularly, on sandwiches, in omelets, on crackers, or melted over dishes, the cumulative sodium intake can escalate rapidly, silently raising blood pressure over weeks, months, and years. Sodium from cheese affects the body in the same insidious way as other high-salt foods. It promotes water retention, increases blood volume, and elevates the pressure exerted on arterial walls. In someone already dealing with hypertension, this is like pouring extra water into a high-pressure system. The arteries become stressed, the heart has to work harder, and over time, chronic strain can lead to arterial stiffening, endothelial dysfunction, and left ventricular hypertrophy. Habitual consumption of cheese therefore contributes not just to temporary spikes in blood pressure, but to long-term cardiovascular damage that often progresses silently until severe complications, stroke, heart attack, or kidney problems appear. The dangers of cheese are compounded by its saturated fat content. Many cheeses are dense in fat, and when consumed frequently, they promote arterial plaque buildup, reduce vascular elasticity, and increase systemic inflammation. This combination of high sodium and saturated fat creates a dual attack on cardiovascular health, intensifying the risks for anyone with pre-existing hypertension. It is not just the blood pressure that suffers. Arteries themselves age faster, becoming brittle and less able to handle stress, leaving the heart vulnerable to failure and irregular rhythms. Processed cheeses are particularly problematic because they often contain additional additives such as emulsifiers, preservatives, and flavor enhancers. These chemicals may not seem harmful in isolation, but in combination with high sodium and saturated fats, they can amplify inflammation and oxidative stress in blood vessels. This subtle, long-term damage contributes to vascular aging and reduces the ability of arteries to dilate properly, making the body more sensitive to further blood pressure fluctuations. Even reduced fat, or low-sodium, versions can still contain enough sodium to elevate blood pressure when consumed regularly, and the added processing often introduces other compounds that may be harmful in the long run. Another subtle danger lies in portion size and frequency. Cheese is often used liberally, sprinkled on pasta, layered in sandwiches, added to snacks and crackers, or eaten in cubes as a quick bite. Many people underestimate the cumulative sodium intake from multiple small servings throughout the day. What seems like a modest snack can quietly contribute hundreds of milligrams of sodium, creating a constant, low-level assault on the cardiovascular system. The silent nature of this damage is particularly dangerous. Blood pressure gradually climbs, arteries stiffen, and kidney function can begin to decline without any overt symptoms until a serious cardiovascular event occurs. Cheese also interacts negatively with other dietary and lifestyle factors. Pairing cheese with processed breads, cured meats, or salty snacks compounds sodium intake, while alcohol or sugary drinks further amplify cardiovascular stress. Even moderate consumption of cheese in combination with these other dietary hazards can create a cumulative effect that is much greater than any single food alone. For hypertensive individuals, the combination of cheese, processed foods, and high-sodium condiments can rapidly push daily sodium intake to dangerous levels. In conclusion, cheese, particularly processed or sodium-rich varieties like feta, American, or halloumi, is far more than a flavorful indulgence. Its high sodium and saturated fat content, coupled with additives and frequent consumption, makes it a silent yet powerful contributor to high blood pressure. Regular intake can promote fluid retention, arterial stiffening, heart strain, and long-term vascular damage. For people managing hypertension, cheese is not simply a minor dietary consideration. It is a significant risk factor that requires careful monitoring, portion control, and, in many cases, substantial reduction or replacement with lower sodium alternatives. Ignoring the risks associated with cheese is akin to slowly eroding cardiovascular health over time, often without any obvious warning, until serious complications emerge.